Hello, it's at 11 a.m. in Seoul. I'm Oh Seong at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from South Korea's health authorities to update us on the latest figures and statistics on the coronavirus situation in Korea. So we're going to go into this Haejong government complex into the briefing room where Director of Public Health Policy Yoon Tae-oh will be briefing us on the latest numbers, the latest number of infection cases and the number of deaths on COVID-19. So we're just about to do that now. We're going to go into the briefing room and it looks like the briefing is going to begin soon as Yoon Tae-oh, the Director General, has just walked in. So we are about to start the briefing right now.
Let us now begin our regular briefing for May 19th, Tuesday. As of today midnight, we have 13 new confirmed cases, and we have 9 cases of community transmission, and the rest of the 4 were imported cases. And as of today midnight, the total number of confirmed cases stands at 11,778, and a total of 9,938 have been discharged following full recovery, while 877 more people are undergoing treatment. And over 740,000 testings were tested so far, and the death toll remains unchanged from yesterday, standing at 263. KSDC held a meeting today presided over by Health Minister Kim Gang-lip, and we discussed issues of the distancing in daily life as well as quarantine measures going forward. Vice Health Minister Kim has stressed that once the community is free and safe from COVID-19, our students can be safe and as we reopen our schools. And we also need to continue to keep our personal self-hygiene, including washing of our hands and wearing of face masks. And the schools will be reopening starting from tomorrow and starting from the senior students of high school, and this will be carried out in a phasal period. And he stressed that we need to hear the laughters of our students at offline schools. And since May 6th, we have carried out the distancing in daily life. And during the day yesterday, we have carried out an inspection for over 20,000 facilities nationwide, including 800 study rooms as well as 488 public transportations. And we have carried out the designation and designing of the detailed measures for these facilities. And we are also doing the crackdown and inspection on nightlife venues. And yesterday we have done a crackdown on more than 9,000 nightlife venues, and we have figured out that about 6,000 of them are suspending from business right now in line with our measures. And we also learned that about 3,000 of them, which are open right now, are strictly complying with the quarantine measures. And the municipalities including Seoul, Incheon, and Daegu, these municipalities are also highlighting the people to wear face masks, as there is a high risk of infection as people are crowded in an enclosed space. And the city of Incheon also have the screening facilities for those who are not documented foreigners, and also those homeless people who are having difficulties to visit the screening clinics by themselves. And they are also expanding the scope of their quarantine network likewise, and they are also enabling them to play as responsible agents in quarantine. And starting from June 1st, the Incheon city will also carry out a QR code entry registration so that they can have a track of the visitors at 14 public spaces, including libraries. And they will also maintain such quarantine measures for the health facilities as well. And in Chungcheongnam-do province, the municipal government is trying to enhance the quarantine authorities, quarantine measures for the high-risk facilities, including the nursing hospitals and long-term care centers. And since we have carried out the social distancing in daily life, we have also a TF team which is undergoing the inspections in the Chungcheongnam-do province. And many of the municipalities likewise are continuing to carry out their exerted efforts to maintain their quarantine efforts. And we hope that these efforts can help the public to return to their daily routines as soon as possible. And in line with such efforts, we ask the members of the public to continue to be disciplined and vigilant, as complacency can lead to another wide big cluster infection, and please comply with quarantine measures going forward. So tomorrow will be the starting of the schools for the seniors of the high school students, and we need to continue to exert personal hygiene measures, including wearing of face masks and washing of our hands, and the ventilation and disinfection as well. And next is about the high-risk facilities as well as their quarantine measures. And as revealed so far, the guidelines also provide the basic principles and protocols for the high-risk facilities, and there are some of the criticisms that they are not tailored to specific facilities. And as they are just recommendations, these guidelines are not implemented to full-fledged at some of the facilities. Therefore, the government is basing on the indexes of risks and possible danger, and we are also categorizing these facilities depending on their risk of infection. And as for the high-risk facilities, we are categorizing them by these possible risk factors, and we are going to provide detailed guidelines for each and every one of these facilities. However, we cannot completely have an extensive and comprehensive guidelines, so these are some of the hurdles that we need to overcome. And these will be dealt with at the fourth meeting with our experts on distancing in daily lives, which will be carried out this afternoon at 4 p.m. And we will continue to consult with related ministries, and within May, we will provide more effective measures for quarantine. Next, from the 18th and 19th of May, we carried out the 73rd World Health Assembly via virtual conference. And at this occasion, President Moon Jae-in highlighted the Korea's efforts for quarantine, and he promised that the country will exert humanitarian support for many countries, and he also stressed that Korea will be committed to developing the vaccines going forward. And Health Minister Bang Neung-hoo also stressed the need for international cooperation and coordination in dealing with COVID-19 during the occasion. And he also stressed that we need to guarantee the movement of scientists, health officials, and businessmen who are essential workers of the governments and nations. And he also highlighted the need for free and transparent exchange of related information in a timely manner. And he also stressed that we need to have proactive participation in the development and distribution of effective therapeutics and vaccines. And Health Minister Park also stressed that Korea's experience and know-how will be a great reference for other countries as we fight the prolonged COVID-19 outbreak. And today, starting from the 7 p.m. session, will be also a second day of the assembly, he also highlighted the fact that we will be designated as a member of the board. And as this member, we will be exerting our full efforts to share our know-how with the rest of the international community and to play as a responsible party in terms of quarantine in the post-coronavirus era. And the government up until now has exerted its full efforts to have established the screening facilities and clinics. And starting from the beginning of the coronavirus outbreak here in the country, we had about 500 of these clinics, and they have been expanded to about more than 600, and we still have more than 600 facilities so far. And they also include the drive-through, walk-through, as well as those made in container centers. And we also have 56 of these innovative centers stationed nationwide, and these have been modeled after by other countries as innovative benchmarks. And starting from the late February and to early May, more than 600,000 people have been tested, and about 35,000 have been tested at the public health centers, while 25,000 have been tested, 250,000 have been tested at such screening facilities. As the weather is getting warmer, the employees and the staff members who are working at these screening facilities are having a difficult time as we have a warmer temperature, and we also disclosed measures to have the AC and the cooling facilities in these centers. And also we have been discussing with the designing of specific measures to deal with a possible resurgence of the virus in fall or winter, so that we can have an effective use of our resources, including screening clinics and our logistics as well equipment. And we would like to take this opportunity to extend my gratitude to all of the medical staff members who are fighting on the front lines to combat the COVID-19. And of January, when we first had the first patient of COVID-19, it was very cold. However, we are now nearing a summer. And as this is the first summer after the COVID-19 outbreak, we need to be fully prepared. And on top of our basic quarantine protocol, we will be considering the weather and providing a full-fledged and multifaceted guidelines for quarantine. We are seeing a stabilization in the number of confirmed cases relation to Itaewon case. However, we still have sporadic outbreaks in the community of local transmissions. We continue to ask the members of the public to stay complacent and vigilant going forward. And we believe that thanks to your high level of civil awareness, as well as the medical experts, have helped us to station our K quarantine as it is now. Thank you very much.
You just had a live briefing from the South Korean health authorities updating us on the coronavirus situation here in the country. We just heard that there were 13 additional infection cases of COVID-19 in the country, bringing the total to 11,078. There were no new cases of deaths. There were no new deaths from the COVID-19 virus in South Korea, meaning that the total death toll remains standing at 263. Well, that does it for our coverage of this morning's briefing. We'll be back shortly in a little while with our regular Arirang news at noon. Bye for now.